my name is Lindsey Thomas. I'm a youth clinician at Summit Point, and I'd like today to talk about one of the most commonly diagnosed childhood disorders, attention deficit hyperactivity disorder, more commonly known as ADHD. It is estimated that more than 6 million children in the United States alone have been diagnosed with this disorder. Symptoms may appear as young as age 6 and often continue throughout adolescence and adulthood. A therapist, primary care doctor, or psychiatrist can use the criteria laid out in the DSM-5 to correctly diagnose this disorder. But a parent might notice some concerns, which brings them to a professional to have further evaluation. Some of those concerns might be the child having consistent difficulty staying on task or paying attention, impulsive behaviors, not thinking about potential consequences before taking actions on a repeated basis, or having very high energy or hyperactivity much of the time. There are two subtypes of ADHD, an inattentive subtype and a hyperactive impulsive subtype. There can also be a combination of both. Let's talk more about what an inattentive subtype might look like. It might seem like the person is making careless mistakes or always lost in their own world. They might be very easily distracted by things around them that the rest of us can block out easily or might not notice at all. An impulsive subtype might look like making choices without regard for consequences. A child might take a toy from another child, push or shove them to get what they want without learning of, again, those consequences. High energy, fidgetiness, falling out of their chair at school, getting up constantly can all be other symptoms of concern. At school, classwork can be very difficult for these reasons. Sitting for long periods of time when they are being asked to, following through and listening to multi-step directions, and struggling with, in some cases, lower social skills can all make it very difficult. There are behavioral therapies as well as medication therapy that can assist. Behavioral therapy might focus on teaching organizational and time management skills to the person. Also, learning mindfulness techniques so that they can stay focused in the moment. Coping skills and calming strategies to deal with frustrations that come from the environment that much of us take for granted can also be very helpful. For school-aged children, one of the most important interventions is to build a strong, positive relationship with that child's classroom teacher, school administrator, and school counselor. An individualized plan that focuses on the child's needs and strengths can be created. Accommodations such as allowing the use of fidget tools, providing scheduled breaks for physical outlet, breaking down tasks, directions, and assignments into more manageable chunks, helping the child to stay organized, using noise-canceling headphones or the use of a quiet area to limit distractions, especially during test-taking time, can all be really helpful and help a child feel successful instead of frustrated at school. It's also important to note and focus on the person's strengths rather than just their difficulties. All people have a set of strengths and abilities that should be acknowledged. In fact, many people with ADHD are highly creative. They also can problem solve and think about things in a way that is really innovative and outside the box. Also, people with ADHD often have high energy, which makes them very productive, driven, and engaging. In fact, there are many successful inventors, entrepreneurs, business people, and others who have learned to harness the gifts of having ADHD in a successful and positive way. So I hope this short conversation has helped you to better understand the diagnosis of ADHD, especially in children, and has given you an understanding about possible ways to support and treat that diagnosis and reframe some of the common challenges with the disorder and see them in a way that can potentially be strength-based.